My name is Ashley. I'm in the ADN program at FSCJ, and today I will be doing the primary medication for the IV. And first of all, I would check the MAR and the physician's orders, and I would look over the patient's allergies and the patient's lab values just to double check everything. Once I've done that and I've verified everything that the physician has ordered, I would check my medication, which would be Restefan, and it's going to be for an infection, and the action is that it binds to the bacterial cell wall and causes cell death. I would also check over the side effects, contraindications, adverse reactions, infusion time, and nursing interventions, as well as allergies and lab values, again, just to double check. After I know that, I would look at my dose, which is 2 grams every 12 hours, and then I would calculate my drop factor, which is 17 drops per minute. And once I have that, I will be ready to start prepping my medicine, the Restefan, to put in the primary bag. So first, I'm going to check the date and make sure that this is Restefan and it looks good. And got my needle with my syringe, and I'm going to drop 1 milliliter of Restefan. Get the air. I'm going to wash my hands and apply gloves. Take my alcohol pad, and then make sure that this is sterile. After that, get this. I have the 1 milliliter of air, so I'm going to get the air in, draw up the 1 milliliter. Oops, too much. Check for air bubbles. No air bubbles. Okay, so then I have that. Then I'm ready to go to my bag and insert the medication. I'm going to prep that too. Put this in the Sharps container, and then I'm just going to mix the medication in there. Then I'm going to label this bag with the patient's name, the drug, the dose, the frequency, the route, the date and time, and my initials. And then after that, this is ready, and I can go ahead and prep my tubing. Make sure it's all locked. Locked. I'm gonna label my tubing as well with the date, time, and my initials, and then I can insert this in here, making sure I don't touch the bevel of the tubing. And I'm gonna some of this in here so I can prime it, unclamp, prime my tubing, make sure that there's no air bubbles. Looks good. Okay, then I'm going to reclamp. Now that's ready to hang. And then I'm just going to wrap this around here, making sure this stays sterile, nothing touches that. Okay, now I'm ready to go into my patient's room. I need a syringe with 3 milliliters of normal saline. And I'd enter my patient's room. I would introduce myself, let them know what was being done, that I'm giving them Restefan for their infection, and that's what the doctor ordered. I would identify them by sending them their name and their date of birth and checking their wristband. After that, I would check the site and just make sure that there's no infiltration or phlebitis, make sure everything looks okay, nothing wrong with the site. Then once that's done, I'm going to wash my hands and apply some gloves. After that, I'm going to begin the ASASH, and I have my 3 milliliters of normal saline. So I'm going to attach this, I'm going to aspirate as the blood return. And then I'm going to use a push-stop method every half milliliter and administer this saline. Push-stop, push-stop, until it's all the way in, except I would have unclamped this and administered the normal saline. Once that's done, I would reclamp. Then, correction, I would have needed to use an alcohol prep pad before I put this on here. I just remembered that. So, yes, definitely would need to do that. And then, after that, I'm ready to attach my IV. Make sure that it's clamped off again, just to double check. And then, need my alcohol prep pad to prep this and this. Then I'm ready to attach it. Okay, once that's in there, I'm going to unlock, unclamp both, and then I'm going to start my drop factor, which is 17 drops per minute, and I will just get it going here in the drip chamber. I'll watch my watch for a minute and just make sure that it's at the right flow rate. After that, I will check the site again, just make sure that everything's okay, and then I'm going to let my patient let this run for an hour. I'm going to keep coming in and checking the patient, the IV site, make sure everything's okay. And then I would take off my gloves, wash my hands, leave the room, and then after checking throughout the hour, I would come back whenever it's done. And then I would wash my hands, reapply my gloves, and then I would be ready to stop this. And then I would take this off. After making sure that these are clamped, making sure this is clamped, and this is clamped. I should have done that before I took it off, but there's nothing running, so. Then after that, let me just get this out of the way. After that, since this is clamped, I'm ready to have another 3 milliliters of normal saline to flush the IV site. So then I would use my alcohol prep pad and get this, aspirate, and then the 3 milliliters I would do every half milliliter, stop, make sure this is unclamped. Once I've administered all that, I can take it off, clamp.
If there were any air bubbles, I would continue to run like this.
And then check the IV site, make sure everything's okay, no phlebitis or infiltration. And then if the physician ordered heparin, I would administer that now, but it was not ordered, so I don't need to do that. And after that, I would just gather all my stuff, make sure that I put all my syringes and needles in the sharps, throw everything away, let the patient know that everything's okay, and that their Recephin was successfully given to the IV. And then after that, I would take off my gloves, wash my hands, leave the room, and I would document everything: the time, the drug, the dose, the rate or frequency, and the patient's name, my initials, if there was any complications, the IV site, if there was anything wrong with that. And then once I'm done documenting, that's it.